Good afternoon, everyone. It is 4 o'clock on a Monday, the time we get the update on this one in every 100-year pandemic, hear about our progress, about what we still have to do, and remember that we're going to get through this, and we're going to get through this together. Let's start with the fact that April 2021 has been deemed National Minority Health Month by the Office of Minority Health in the United States. OMH was established in 1986 and charged with improving the health of racial and ethnic minority populations through the development of programs to help eliminate health disparities. And while we've made some strides, COVID-19 has certainly laid bare inequalities in healthcare access that have plagued our nation for far too long. But here in Kentucky, I am proud of the work that all of our communities have come together to make, creating a priority for more accessible and affordable health care for all Kentuckians. We launched the 1-2-3 campaign in the midst of this pandemic, seeing disproportionate cases and deaths in our minority populations, and it has signed up more individuals for health care, and it has changed the course of this pandemic. We are currently ensuring that we have an equitable rollout of our vaccines, and we have more work to do. But given that it is National Minority Health Month, I'm proud to report in our newest statistics on cases and deaths, we have now either achieved the same amount or even less in most cases and deaths that many of our minority groups make up of our population. For instance, Black and African American Kentuckians make up 8.4% of the population of our state. To date, and just think where we were in the summer, but to date, they make up only 8% of all cases and 8.1% of COVID deaths. Now, obviously, in any of our demographics, we don't want to see any deaths, but this used to be 16% and has been cut in half based on efforts that we've been working on hard since before last summer. Multiple or other races, multiracial individuals, 5.2% of our population, 5.3% of our cases, 2.6% of our deaths. For Asian American Kentuckians, 1.6% of the population, 1.1% of cases, 0.5% of deaths. On ethnicities, Hispanic Kentuckians, 3.8% of the population, still some disproportionate cases, 5.5%, but only 1.5% of deaths. So there's been a lot of hard work, and it shows that being intentional and recognizing unequal access can help us develop strategies to actually move the ball forward, protect lives, and do better. All right, our vaccine report today. If we show chart 1, table 1, we now have over 1.665 million Kentuckians with at least their first shot of hope. And that means over half of Kentuckians 18 and older have now been at least partially vaccinated. That is a big milestone. It's one we ought to be excited about, but we also know that we have a lot further to go. Now, we are still having some issues from when we upgraded the security in our system to getting all of the reports from all of the vendors about the vaccinations given to date. I actually believe that number is higher. We know that there are some we haven't been getting, and so we're working through all of that right now and hope to get caught up very soon. But if we look ultimately at table 2, what we see is we have a lot more doses out there, and people can get them right now with about 400,000 doses that are available for people before we get the next group of at least 150,000, which typically starts coming in tomorrow. Meaning we can get more than halfway that we have to go to hit our goal of 2.5 million Kentuckians vaccinated. And that's when we eliminate just about all capacity restrictions. We could get there quickly. We have enough vaccine out there to get halfway there right now if everybody would get out there and would sign up. A couple of things as we'll get to the demographics here in a second. 74% of all Kentuckians 70 years and up now vaccinated. It's a good number. We want it to continue to grow, but those are the most vulnerable. 60 to 69, also pretty vulnerable to this virus. 63% of Kentuckians vaccinated. 50 to 59, only 46%. Remember, this has impacted that group significantly. And then as we get younger, 40 to 49, only 38%. I'm going to talk in a minute about how many cases that group makes up. I'll do it right now. It's 15.1% of all cases are from 40 to 49-year-olds, and 20 to 39-year-olds, another 33.5. So when you look at it, almost 50% of all COVID cases we've had are between ages of 20 and 49. But that's when we see 38% or less of individuals in that age group currently vaccinated. So we need to pick it up for our younger Kentuckians if we want to lessen the number of cases and ultimately defeat this virus. When we get into the demographics, if we can start by age, again, we're starting to see other age groups catch up to the 70 plus because there are more people in other age groups. We're seeing a good rise again in some of those areas, but now that it is open to everyone, now that there, I think, are 15,000 plus appointments, even just in the U of L Cardinals Stadium site this week, we should significantly increase Kentuckians 20 to 29, 30 to 39, and 40 to 49. Folks, it's time. We need your help. We need you to do your duty to defeat this virus. And the variants, which we'll talk about in a minute, are coming for this age group more than others. And it's now this age group that is making up the majority of cases each day. When we look at gender, this continues to get closer to parity, 55.8% female, 44.2% male. When we look at race, we continue to improve incrementally. We are now 5.45% Black or African American. That was 5.2% last week, 1.52% Asian American. And then the others are all below 1%. On ethnicity, continue to make some progress there too, with 2.4% now at Hispanic versus non-Hispanic. We continue targeted efforts. They are working. We will continue to see these numbers improve. But folks, vaccines work. And for folks that have taken the vaccine, they virtually eliminate serious illness and they eliminate death, and they do that even in the most vulnerable of populations. And I've been trying to find the way to show this graphically in a way that is real and visceral and makes the point that you need to get your vaccine. So I want to look at long-term care facility COVID-19 deaths per week. And this is hard because at one point it got so significant. If we look at, again, early on, what we saw as this was running through facilities as we didn't know enough about the virus to keep it out. Then we do a lot of intervention, a lot of testing, and we see it decrease a little bit. But then you look, especially in that period, October, November, December, this is when, even up to that point, long-term care deaths were 68+% of all deaths, more than 2/3 in Kentucky. And guess what? We started vaccinating, and look at what happened. These are folks that the virus comes for, and the vaccines virtually eliminated death caused by them. These are miracles. They protect you. They can get us fully through this pandemic. And just look at this chart. If there were individuals who, even with the vaccine, are going to succumb to this virus, sadly, it would be in this group. But look at how effective they are. That drop-off is what can occur in our entire population, in cases and in deaths, even from where we are right now, but only if we get out there and get vaccinated. And we need to, because as we look at our new COVID cases by week, what we see is that our plateau continues. maybe even starting to see a slight uptick. This last week, we had more cases than the week before, but slightly less than the week before that. But when we look at our test positivity rate, that's when we start to see more of an increase. And as Dr. Stack has taught us, positivity rate is a leading indicator, while cases are a lagging indicator. So let's be clear. We will have a fourth wave of this virus unless we get everybody out and get vaccinated, and we continue to engage in safe practices until that happens. Now, will that fourth wave occur primarily just in unvaccinated individuals? A large portion would. But as long as there's a significant group of unvaccinated individuals, there are hosts for this thing to mutate in, to where it can also then potentially develop a strain that gets to more vaccinated individuals. We don't want a fourth wave in anybody. We care about everybody. If you haven't been vaccinated yet, we care about you. We want you to get vaccinated. We want to protect your life and those around you, and we don't want this virus to use you to develop a strain that can then go get somebody else that's been vaccinated, and I know you don't want that too. So again, we need you to do your part. We look at inpatient census. Again, we are either at a plateau or starting to see just a little bit of an increase in states that have seen their cases go up, their hospitalizations gone up too, and it's younger people that are impacted. ICU, the same. It's hard to know from the graph if we are still plateaued or maybe at the beginning of another increase. COVID patients on a ventilator, here we see more of that regular plateau. Variants of concern in Kentucky, they continue to increase. Now 179 total variants of concern, 173 of them are the B117. Hospital capacity, which we give updates on each Monday, still in a fairly good place. Only one area in the state that's in the red zone. They're in it for the ICU beds. Hospital capacity right now is not an overriding concern. What is our plateau, the definite possibility, if not probability, of a fourth wave if we don't get individuals vaccinated. And then at least a lot of folks right now being casual towards vaccination when we need you to be motivated. But certainly we have fought really hard to get where we are, which is a much better place than we saw in the fall and in the winter. And it's let us to be able to loosen some of the restrictions that were previously in place, and they've now allowed us to streamline some of our guidance. So we've got Dr. Stack here today to talk about Healthy at Work, some simplifications that we have been able to do. One that I hope people are able to enjoy, but again, safely by wearing these, is we're going to be able to increase our capacity allowance in larger places like outdoor stadiums and indoor arenas to 50%, provided they follow the Healthy at Work guidelines. So here's Dr. Stack. Got to take that with me.
Thank you, Governor. Good afternoon, everyone. So we're updating the Healthy at Work paradigm this afternoon, and the website should go live here during the presser. If you could show my first slide, James. The first Healthy at Work guidelines and requirements helped us to reopen Kentucky early in the pandemic. So as you remember, last fall in 2020, or I'm sorry, last spring in 2020 was a time of great uncertainty, and steps had to be taken to minimize the spread of what was really and remains a very dangerous disease. We very quickly went through that phase and worked to find ways to be able to reopen Kentucky and get people back to work and back to their activities in ways that were safe to minimize the spread of disease and to reduce our collective and individual risk. When we did that, we went industry by industry or sector by sector and wrote a number of guidance documents. What we're releasing today now simplifies that guidance so it's easier for Kentuckians to follow and easier for Kentuckians to stay safe. The new version is simplified in that there is a single minimum requirements document like before, but that is the only document the vast majority of businesses will need to use. That document includes important concepts like physical distancing, facial covers, hand washing, proper ventilation, surface hygiene, promoting telework, minimizing areas where people congregate, sanitation, health checks, and those are all described in relatively succinct fashion with links to certain CDC guidance for additional information for some of those areas. In addition to that, there are 5 other documents. If you could, before I pause or before I move on here, if you go back, James, I'm sorry, just to emphasize what the governor said. One of the simplifications is there is now a cut point for gatherings up to 1,000 persons or for over 1,000 persons, and the governor shared this. So the 60% capacity restriction is in place for gatherings that are under 1,000 persons. And now today we have elevated and simplified the guidance for gatherings over 1,000. So it is 50% for any gathering over 1,000 persons. So that there is significant. It's also significant as graduation season is upon us. And so that guidance is effective as of today. Now, James, if we go to the supplement page, there are 5 supplement documents. These are for industries where there are some unique characteristics or activities where there are unique characteristics with additional guidance. These are for healthcare facilities. Now, for healthcare facilities, please note that the healthcare executive order, which we used last year to reopen healthcare, will be rescinded today. And this healthcare facilities guidance will be what gives direction to the healthcare facilities. There's also a document for weddings, funerals, and memorial services. There's a guidance document for restaurants and bars, one for pools and bathing facilities, and also one for gyms, sports, and exercise facilities. I think when those of you look at these, you'll find that they are more concise, they are cleaner, they are simpler. Please remember, though, everyone has to follow, every place of business has to follow the minimum requirements. And then if one of the 5 supplemental guidances apply to you, you have to follow those requirements as well. I look forward to the day when we put COVID behind us and none of these guidances are needed and these requirements are unnecessary. The way we get there, though, is for everyone to make the choice to get vaccinated. And the governor has shown the slide with the impact on the long-term care facilities. The vaccines protect you, they keep you safe, and when you look at relative risk reduction, hands down, these are amazing tools to help us get our lives back and get back to the activities we miss. There are plenty of places to get vaccinated, and as the governor said, now it's really just a matter of finding a local pharmacy near you, and progressively in the weeks ahead, there will be more opportunities even in other areas as we expand now to more regular offices and other settings. So thank you very much, everyone, for getting us this far. Let's just carry it across the finish line and all get our shot of hope when we have the chance. Thank you.
All right, and today's COVID reports, we have 231 new cases of COVID-19. Of those, 168 are individuals 49 and younger. This is going to be a statistic we're going to start talking about because this virus is now hitting people, again, 49 and younger at a much higher rate than it did before, and it's causing much more significant issues in that population. So a very significant portion of today's report falling in that age group. Our current positivity rate, 3.46%. And today we're reporting 9 deaths, 4 that come through the local health department route and 5 that continue through our death certificate audit. Of the local health department route, we have a 90-year-old man from Boone County. It's a February death. An 88-year-old woman from Livingston County. It's a February death. A 61-year-old man from Pendleton, late March. An 80-year-old man from Shelby, February. From the audit, a 91-year-old woman from Bell. That was in December. All these are December. 93-year-old man from Boone. 84-year-old woman from Greenup. 98-year-old man from Hardin. And an 85-year-old woman from Jefferson. I want 4 out of the 5 were in long-term care. And again, were before we were able to start the vaccinations. Remember, we got the vaccines, I believe the first day they came in was December 15th. And all of these are within 4 days of that date. The vaccines have done incredible work. I mean, look at our long-term care report today. Again, staff, always now, we have more positives among staff than residents. Why? Residents got vaccinated at a high rate. The staff did not. Thus, those that are most susceptible in a facility that would even catch it easier are not getting it while the staff is. So 6 new residents testing positive, 10 new staff, 0 new deaths again. This is now my favorite part of these updates, which have been so hard, especially on long-term care, when we can say 0 new deaths. And I want to give a shout out to a couple of places that have gone above and beyond to educate and to encourage staff and residents. Episcopal Church Home, 75% of staff vaccinated, 98% of residents. That is on the nursing home side. On the assisted living side, my goodness, Atria has done a phenomenal job. I believe their lowest facility is 93% of staff that is vaccinated. So a wonderful job done by that company, also headquartered in Kentucky, to protect its residents and its staff members, all of which are safer because of it. So all these other facilities and everywhere else, every place of employment, we need your help. We need you to encourage. We need you to talk to your employees. We need you to talk to your patrons, because the safety of all of us depends on enough of us making the right decision. And we want everybody to get past the finish line as we defeat this virus. So with that, we'll open it up to questions because we're moving fast today. Karen Czar from WUKY. Do you need to turn on the speakers for me to hear? Okay, we can't hear from Karen at the moment. James, are we getting anything from anybody? All right, let's try Karen again.
Can you hear me now?
I can.
Hello. Yeah. Good afternoon, Governor. Hello, Virginia. Over the last few weeks, we've had between 6 and 8 red zone counties, kind of on average. I know it went up just a little bit over the weekend. And while it's fewer than we saw several months ago, they do seem to move around a bit across the state to different counties. When you track that movement, what does it indicate, if anything? And has it changed your approach at all along this as far as the vaccination program? Thank you.
Well, what we see is that, especially with the variants, and there's no reason to believe that, like other states, we're not predominantly the UK variant by now, that it can spread very quickly. And so once it starts spreading in a county, it can become red very quickly. Now, but how we stop it is the same as how we stop the traditional strain, and that is masking, and that is vaccines. It hasn't changed our vaccine approach, Karen, only because we have a ton of vaccine in every county right now. In any county that turns red, there are hundreds of appointments in that county or close to it that people can get. Now, I think you raise a good point, though, that for red counties, it ought to set out an alarm in that county about going out and getting vaccinated, though I hope people feel that alarm right now. But where we are in vaccines, and it's something that we hope people will get motivated, and we hope that businesses will incentivize and everybody will do their part, is 400,000 vaccines out there right now for the taking. Means any red county could not only get out of being red, they could eliminate any possibility of being red again if just enough people would go out and take that shot of hope. Kimberly Keegi from WSAZ.
Hi, Governor. Hi, Virginia. Good afternoon. I wanted to ask you as a follow-up, as we're a week out away from your initial setting of the goal for 2.5 million people to be vaccinated in Kentucky. Realistically speaking, it seems a little eager to be hopeful that the amount of people could be vaccinated within 2 to 3 weeks or a month at the least amount of time frame. Realistically speaking, if people aren't able to get their vaccine right now, how far out are we anticipating that it could take? Thank you.
Thank you. Everyone can get their vaccine right now. This all depends on how many people are willing and how much urgency people feel. So with the number of vaccines that are out there right now and the amount that we expect to come in each week, it is theoretically possible that we could get enough people vaccinated to hit the goal in 3 weeks. Now, that's not going to happen because right now it appears that we have about, well, if you look at the last 3 weeks, about 125,000 people-ish a week getting vaccinated, and we're watching very closely to see if demand has gone underneath that. So without any pickup right now, but staying steady, you're looking somewhere around the end of May. Or maybe just a little bit later, but we can get this thing done mid-May if people will, again, show up and get the vaccine. And this isn't, I mean, sure, it's meant to incentivize people, but it's also set at a level of when it's safe, right? Because with a virus like this that spreads, when you open up capacity, the virus has a better chance to spread and to aggressively spread, unless we have the right amount of people vaccinated, in which case it doesn't have the opportunity. So again, I just reinforce that this number that we set is all about safety and being able to be closer together. Now, we hope that, again, we will see an uptick, especially with the number of people, say 16 to 49, that are now eligible that haven't gotten vaccinated. With that group alone, we could reach that 2.5 in the coming weeks. Shamaria Morrison, WPSD.
Hi, my question has to deal with unemployment. So today, the unemployment rates for the counties was just released today. In addition to that, here in West Kentucky, our regional Paducah unemployment office just opened. So we have a lot of people wanting appointments, and we were hit pretty bad by unemployment here. I remember last year you saying the unemployment system was set up that everyone just would not get paid out. And I was speaking to a lady today that this might be impacting. So what are you saying to those people who are still fighting to get back pay from the system and, unable to get appointments just right now because it's just such a, everyone's just trying to get an appointment to be in person since it just opened up?
Well, we're excited about how in-person appointments are going, both in the amount of appointments that we have scheduled, and starting it was today at midnight each night, new appointments open up for, I believe, a month, I think, or no, 2 weeks that are out. When we look at the number of people that we're seeing in each 2-week period, as well as the quality of the visits, I think this is going to significantly help us. Our system is also working a lot better since we did the reboot. We can see hackers trying to get in, but they are not getting in. So we think we are making good process improvement steps, and we believe we're going to be able to work through the real claims through the in-person appointments without having to dig through the fraudulent claims. So what I'd tell people is I think help us on the way. It is still a lot of claims that are out there that we got to get through, but we are committed to getting it done. Also, steps we've taken are going to help us prevent people from stealing your money. And that's the point that we were at when we had to do that 4-day shutdown. We're going to continue to work. We've hired or brought over 150 people to reset PINs. Again, I think that our plan is moving in the right direction, but still a lot further to go. Now, what I will say, though, is people are hiring. Get your vaccine. Look at these openings that are out there. There are lots of good jobs out there. Taking a good job right now will not prevent you from claiming the unemployment that you would rightfully qualify for going back. But folks, if you get vaccinated, and it's time to get back out there again with a lot of good jobs that are available right now at our career centers. In most places, we have employers that are there with applications that would love to help each and every one of you on your next step of your career path. Catherine Collins from WLEX.
Hi, Governor. Can you speak to the arrest of a protester in Louisville yesterday and the criticism that that's received? And also, has the state been involved in any preparations for protests that may happen following the Derek Chauvin trial?
Well, I know that the Kentucky State Police and others have regular communications with LMPD and others. I haven't been read in on any specific preparations at this point. I'm still learning more about that arrest, which was recent. Certainly the pictures of the individual and his bruising are concerning. This is something that each time, if there is a level of violence, we need to look at it. We need to analyze it. If it's wrong, we need to admit it and we need to learn from it. And I hope that we are moving through that process in a real and transparent way. Debbie Yetter from the Courier-Journal.
Hi, Governor. Are the changes on capacity you described today and other changes, are those effective immediately? And how do they differ from what you would announce if the state reached the 2.5 million vaccination goal?
So what all that was changed today were our large venues. Those are over 1,000 people. These are primarily our stadiums and our arenas, and they have done a very good job at ensuring everybody remains masked. We have seen very little spread through them. In fact, we've seen some of the best adherence to masking at them. So the only change that happened today is they went to 50%. I believe one was already at 40 and the other was at 35. Now everyone is exactly at 50, and that has to be throughout the entire facility. You can't take 50% of an entire facility and put them all in the lower part of the arena or of the stadium. We believe it can be done safely, and that those partners have actually been really good partners about the safety of their facilities. So that's the only change today. Obviously, under 1,000, we would be able to fully lift. That we'd still have masking in place when we reach 2.5 million Kentuckians vaccinated. And then we'll look at the larger, again, stadiums and arenas about where we could go from that 50% level. Melissa Patrick, Kentucky Health News.
Hi, Governor. The Foundation for Healthy Kentucky's latest poll found that 43% of Republicans said they probably would not get a vaccine, or definitely not. And a state poll in Tennessee found that number to be even higher at 69% of white rural conservative residents unwilling to get a vaccine. Has your own polling found comparable figures to those in Tennessee, or can you talk about that a little bit?
Yeah, we've seen some variation on that, Melissa, but there's no question that we're seeing the largest amount of hesitancy among, typically in the polling we see are amongst people who identify as Republican right now. We have seen some difference in whether it's more men or women, but there's no question that is a reality that we face. And to me, it's unfortunate because our political parties are just constructs, right? And this virus doesn't care. Whether you decide to put a D or an R behind your name, it'll kill you just the same. And with a virus that just operates in a certain way that we can understand from science, and with us needing to get enough people vaccinated to beat it, which is math, I would hope, given those are subjects we all agree that we should take, that we could all reach the right conclusion and do the right thing. It would help to see more leaders or outlets that that some of those that are skeptical listen to be stronger on the need to get vaccinated. Obviously, that's something that's not in my control, but I can encourage. I would say to everybody out there, I don't care if you're a Democrat or Republican. As your governor, I don't care on anything that we do. My job is to do the best I can for you, and I represent each and every one of you. And listen, I want to put politics and partisanship behind us for good. It's gotten far too divisive. It's gotten far too nasty. It's groups of people trying to dehumanize other people. And now it's the craziest stuff you'll ever read on the internet that some people believe and use as a reason to hate other people. I mean, it is far past the point that George Washington told us parties would drive us to. Certainly, when it comes to something like life and death, I just want people to be protected. These vaccines work. Statistically, they work. Certainly, Moderna and Pfizer have almost no appreciable side effects or risk, and they are so effective in keeping you alive. And they're effective in keeping alive the people that you love and care about. It looks like they're pretty effective in keeping you from getting the virus and bringing it home to your kids. And they're effective in giving us enough protection to where all the things that you might not like that we're having to do, we don't have to do anymore. So please, everybody, I'm asking, I'll beg, I'll show you the science, I'll bring you the scientists, your doctor will talk to you about it, I hope your minister will talk to you about it. Please get this vaccine because, again, we got to get through this together, and it doesn't care what party we're in. Corinne Boyer from WEKU.
Hi, Governor. I have a question for Dr. Stack.
All right. He's coming. Go ahead.
Okay. I've seen that some state health agencies have called new COVID infections in people who've been vaccinated breakthrough cases. Do you think that term is problematic considering that vaccines are effective and reduce the severity of disease, but they don't necessarily prevent you from getting the virus? Thank you.
Sure, thanks for the question. So the question is the use of the terminology breakthrough infections for someone who is vaccinated but who still gets infected. I think that's a commonly used term for this, and the vaccines can be incredibly highly effective, and you still are going to have some people who don't mount as robust an immune response and still get infected. So this is going to happen. This is not a surprise that it happens, and it's quite predictable. The thing that's really remarkable about these vaccines we have now is how they were able to be designed to be so effective that overwhelmingly you have 90+% of people who appear to be protected from the worst harms, which would be a death and severe illness going into the ICU in a hospital. So we know people, a small number of people will still get infected, but if they're protected from the greatest harms and the vaccines have done precisely what we had hoped they would do, we need more evidence, but the evidence is getting accumulated over time. But people who are that well protected are very likely to also be less likely to transmit the disease to other people. So that will help with transmission as well. The third part of this is if you have an unvaccinated person, even someone who is well protected and has minimal or no symptoms from the infection could still transmit it to an unvaccinated person, and they would get the full brunt of the virus or the disease if they get infected. So I think the breakthrough terminology is pretty consistently used in this context. And no, it's nothing a surprise about it. And these vaccines are very, very highly effective. Thanks.
Tom Latek from Kentucky Today, because it wouldn't be a press conference without Tom Latek.
Thank you, Governor. Good afternoon to you. I got three quick ones for you here. The first one, the 50% rule that you all announced today, will that include the Kentucky Derby? That's the first one. My second one is we haven't heard about this much for a while. Early on in the pandemic, there was a respiratory illness, a very severe one that struck young people, children. Wondered if that is still out there and if Kentucky has seen any more. And then finally, anything new on the Johnson & Johnson pause status?
The Johnson & Johnson pause, the only new information is that it looks like the CDC and the FDA are looking at a handful, that's how they describe them, of additional potential people who had significant side effects, but they haven't confirmed how many. But again, it appears low. Dr. Fauci says he hopes that this week we will get some guidance on how and where we can use it. On Derby, they have their own plan, which we have seen, and it won't be impacted by today's announcement. Remember, they have so much space that I believe most of their plan is designed to create distance between people as opposed to just capacity. Finally, on children, I think we continue to see that syndrome, but it does appear and has stayed rare. Though the more virus that's out there, even if it is rare, it is going to impact more children. Remember that even something rare that occurs in point something %, that's multiplied by the total number, right, of children that would get it, meaning the more virus we have, the longer it takes us to defeat this pandemic, the longer that people wait to get vaccinated, the more people who get sick, including the more kids who get sick. Chad Hedrick from WKYT with our final question.
I'll try to make it a good one, Governor. As the pause for Johnson & Johnson continues, do you think that this is just adding to the hesitancy for people to get the vaccine, which then in turn could delay hitting that 2.5 million goal? And then if it gets to that point where we're beyond that 4 to 6 week time frame of getting there, do you consider adjusting it a little bit to lift some of these restrictions?
Yes, the Johnson & Johnson pause hurts our efforts. It just does. It is not helpful, and I'll be interested to see what the final decision is. If it ends up being okayed for everybody, then we let what is a small risk, which I know harmed and even took the life of at least one individual, and I don't want to downplay that. But still, statistically, it would have taken a small risk and created a much bigger risk to people from dying of COVID. Remember, right now, we think the risks of having a serious complication to the Johnson & Johnson vaccine is less than 1 in a million. But based on how many people have died in the United States versus the overall population, your risk of dying of COVID is about 1 in 550. And if you took kids out of that and you adjusted it for age, it's a lot more likely than even that statistic. So this has not been helpful at all. But it's just one more thing that COVID has thrown at us and one more difficulty. Getting through a pandemic's not supposed to be easy, so we can't make excuses. We just got to get it done. And the second piece, James, what was that? Chad, you want to give me the second part of that question again?
Yeah, at what point if we get beyond the 4 to 6 weeks that you were estimating 0.5 million and you see we're not there yet, do you consider maybe adjusting that a little bit or just lifting some restrictions,
Sure.
Maybe not to the scale that you're hoping for?
Right, we'll consider it. Certainly the lifting of all capacity restrictions for venues under 1,000 is when we hit 2.5 million. Whether or not we can make some adjustments before then, if it's taking longer to get there than it should, we'll see. Again, it'll all depend on the number of people vaccinated, and it may depend on the type of venue and the safety that it does or does not provide. But I tell you what, I want to get rid of these restrictions. I want to get rid of all of these capacity restrictions. And it's pretty easy how we do it. We got about 800,000 more people that need to get vaccinated. That's 800,000 people that won't die from COVID and won't get seriously sick from COVID. So that's a really good thing that allows us to do a really good thing. All right, everybody. It's this simple now. Get vaccinated. If you've been vaccinated, talk to other people about getting vaccinated. If you are in a group that would benefit from, again, a capacity opening up, encourage everybody to get vaccinated. There are areas in state government where far too few people are vaccinated. We need to do a better job of encouraging people to do it. And so let's all think about doing this together. Think about every possibility, every incentive, everything that it'll take, because we have got to get there. And again, yeah, politics muddies everything up, but I'm not thinking about that. This is issues of life and death, and even people that we'll have to talk to a number of times and help them get to the right place. It's their life and death that's on the line. So be compassionate in those conversations. Try to be understanding. Try not to get frustrated. I get it. I get the feeling of frustration, but it hadn't been easy to fight to save people's lives thus far in the pandemic. And there's no reason to think it was going to get easier at the end, but we are so close to the end. So let's keep working. Let's make sure we're protecting everybody out there. Offer that encouragement. Let's get it done. We'll be back on Thursday. Thanks.
Afternoon, everybody.